So when we look at the cancers which commonly affect men in our country, the first and foremost is the lung cancer, which affects the lungs. The second most important cancer which men are affected is the stomach cancer or the gastric cancer. So when you look at the lung cancer, I think this is usually associated with habits like smoking, which is commonly linked to smoking, and we find most of the men who are habituated or addicted to smoking in their lifetime may have this sort of a lung cancer. So that is the commonest cancer what we come across men in our country. So this cancer usually when it's detected in an advanced stage because of lack of symptoms in an early stage. So we find these cancers presenting in 4th stage or 3rd stage usually, because by the time they grow to a size which is more than 2 centimeters, at which time the symptoms are seen, I think it would have already been blood-borne. So this is the commonest cancer, and though it is linked to smoking, but there are many patients who present with this cancer even in non-smokers. So non-smokers are also not or immune to this sort of a lung cancer, because people who are exposed to asbestos industries, occupationally they are exposed to dust and pollution. Recently, I think the pollution is also has been included as a causative factor for lung cancer. So because of the pollution levels which are very high, because of the automobile pollution, industrial pollution and many other pollutants, I think WHO has recognized pollution, atmospheric pollution also as an important cause of lung cancer. So people who do not smoke also can have lung cancer because of this symptom. Again, passive smoking. So when a person smokes, the second-hand smoke, what he releases into the air, if it is inhaled by the people who are surrounding him, I think they are more prone for lung cancer. And the second-hand smoke is more dangerous than a first-hand smoke. That's why the government in many countries have imposed a strict rule that smokers have a smoker zone. So we find these smoker zones or smoker rooms now in airports, railway stations and public places, where they cannot smoke in public places. So the second cancer that is commonly seen in our country is a gastric cancer. That is what we literally, in terms we tell is a stomach cancer, which is not typically a stomach cancer, but it's not an abdominal cancer, it is a stomach cancer or gastric cancer. So this cancer again is related to lifestyle habits. So it is seen in our country most commonly because, especially so in South India, because we are used to eating spicy food, chili food. So those who have been habituated to eating this high quantity of chili food or mirchi food are prone to this sort of a gastric cancer. And those patients or people who regularly take high spicy foods or pickled foods or smoked foods, which is commonly seen in the Andhra region, and those patients, people who tend to smoke and drink alcohol regularly, have a very high incidence of developing this cancer. So this cancer is generally related to smoking, intake of alcohol and intake of high chili foods with high salted and pickled foods. So this is commonly seen in male, and though in female it comes into 4th position, but still in men it is the most common second cancer that is seen. So these cancers also can be detected early, provided they notice the symptoms very early, like early satiety, loss of appetite after taking small quantity of food. All these are indigestion and formation of gas too early after food are early symptoms associated with this sort of a cancer.